Mr. Pritam Singh.
Thank you, Mr. Speaker. So I have two questions. The first pertains to a subject I believe that was covered both by the Minister of Health and the Minister of Education. This concerns the apprehension some parents have over the administration of mRNA vaccines for their children. These parents anecdotally are not anti-vax per se. I mean, some of them may have taken the mRNA vaccine on their own. But the concern is really a visceral one about the long-term effects, the fact that this vaccine is, we've heard of emergency approvals and so forth, even though I think some have been granted FDA approval, Pfizer-BioNTech in particular. To that extent, will MOH allow such parents to wait until non-mRNA traditional protein-based vaccines are approved for their children's inoculation so as to give them more choice and to assuage their concerns? The second question follows. I understand one such non-mRNA vaccine company, Novavax, submitted data for approval under Singapore's Pandemic Special Access Route, PSAR, on the 22nd of November. Director of Medical Services confirmed a few days ago on the 5th of January that he was very optimistic Novavax would be authorized as a non-mRNA booster. My question is if Novavax or any other non-mRNA vaccine maker has submitted data for the authorization for use for children above the ages of 12, and if so, when can these vaccines be expected to be introduced on the national vaccination program? Just a very short follow-through on that with regard to the point made by the Minister of Health on the 270 days that are required before the limit before you take a booster and then to be recognized still as being vaccinated. Would there be some flexibility to allow Novavax at least to get on this program and to allow more individuals to then be considered fully vaccinated? Thank you.
Thank you. I can fully appreciate parents' concern that mRNA vaccine on children, they'll be concerned about long-term effects and whatever side effects there may be. Just a few facts, which is the children vaccine, Pfizer-BioNTech Comirnaty, has gone through extensive clinical trials. And during the clinical trials, it was shown to be safe and effective. Specifically, myocarditis, which is what most parents are concerned about in children, it occurred. Currently, there's about 8.5 million already vaccinated in the US, and the incidence rate is about 1 in a million. And as SMS Janil mentioned, you have to balance this against the downside of getting infection. If you are infected, the chances of myocarditis is 45 in a million. And also other effects such as MISC, which can make the child really sick. And we have seen a handful, 1 or 2 a week, when Delta was at its peak, and they are admitted to ICU. Thankfully, all of them recovered. So there is good track record of safety and efficacy for the children vaccine. And on the other hand, if you are infected, for children infected with COVID-19, while generally children are more resilient, we have seen cases myocarditis, MISC. So it is a pandemic crisis. We do have to weigh those costs and benefits. I do have to add one more fact, which is that for the children vaccine, it is a diluted form. They are not taking the same adult vaccine. Pfizer-BioNTech, for example, is 1/3 the dose of an adult. So these are the facts, and parents will have to make the right decision. As of now, we are quite encouraged that actually many parents are coming forward. And the pediatric vaccination exercise is actually gathering pace, and many parents are coming forward to protect their children. On the question of Novavax, it is being assessed by HSA. I think we need to let the scientists do their work. And I think we should consider putting it into our national vaccination program. We have always wanted a good portfolio of mRNA and non-mRNA vaccine. But as for the timing, I think it may take a while more, including for delivery. Plus, another process for assessing whether it's suitable for children. There's another set of data, another set of trials. So I don't know how long it will take. In the meantime, Omicron is upon us, highly transmissible, and we do not want to rule out that even a small percentage of children can get very sick. We might be looking at a significant absolute number. So I would suggest, as SMS Janil have advised, get your child vaccinated with mRNA, given the circumstances. It's not perfect, but I think given the circumstances, cost and benefits, I think the right thing to do now is to get your child vaccinated as quickly as possible. Likewise, for the 270 days, I can understand what the Leader of Opposition is suggesting, whether we should wait for Novavax. But again, Omicron is upon us. And we do, while I hope we have the luxury of time to wait for a non-mRNA vaccine to be available, but with the impending Omicron wave, I think we should act quickly, and therefore we set a validity period of 270 days.
Mr. Yip-Hon Wing.
Mr. Speaker, I thank the ministers and the SMS for their replies. My SQ is for SMS Janil. Some young children may have undetected medical conditions and especially allergies if their parents do not send them for non-mandatory medical reviews. As such, I wish to ask whether MOH would advise all young children to undergo a medical review before going ahead with the COVID-19 vaccination. This is similar to how some adults with underlying medical conditions are advised to get clearance from the doctor in the early stages of the vaccination drive. Thank you.
So I thank the member for his question. The answer is partly in the last line that he stated, which is that we took that approach in the early stages of the adult vaccination drive, because at that time the amount of data that we had was less, the amount of experience that we had was less, and now we know a lot more about both the disease as well as the vaccination, including in children. So the approach for children is not so different from adults. If they have an underlying condition, and there's a list the doctor will know about, then some review needs to happen. But if the child is otherwise healthy, then the recommendation is to proceed with the COVID-19 vaccination. The issue of allergies is slightly different in that for any drug, you can't necessarily tell whether an allergy will happen or not happen on the basis of prior underlying conditions. And hence, the team at the site of the vaccination is trained to then detect and deal with the rare allergies that do happen. And again, our experience with COVID-19 is it doesn't happen any differently from other vaccinations that we're giving to children on a regular basis. So the short answer to the member's question whether all children should go for medical review prior to COVID-19 vaccination is no.
Mr. Jerogam.
Thank you, sir. I've got two supplementary questions. The government has been encouraging the use of ART testing to prevent the spread of viruses. However, in many situations, self-reporting of ART results is not allowed. Instead, people are required to conduct the test only at approved testing centers, which not only cost more, but are more inconvenient. Can we move to a regime where people are trusted to accurately report their ART results, just like how it's done in schools and indeed here in Parliament? This will reduce the cost for many people and make administrative procedures at events more efficient. Second question, there is a tendency for some activities to be prohibited, even though the transmission risk is low. Can the lead agencies issue more specific advisories to organizations based on the actual prevailing risk of viral spread so that we move closer on the path towards normalcy? Thank you.
Thank you for those suggestions. Relying on individuals to self-report ART tests, this is, as Mr. Giam has acknowledged, is actually in place, such as in Parliament, not quite, because you do get informed by a SMS that you are negative. Yeah. But there are many settings where we do rely on self-reporting. Workplace, for example, a lot of meetings, events you go to, you self-test. We have an entire protocol, what we call Protocol 2, that is based on self-testing. That you self-test, if you're positive, you stay home 72 hours. After that, daily test, and only when you're negative, you come out. It's totally honesty-based system. Yeah. And if you're positive, you come out, you're negative, you stay at home. And so answer is, yes, we very much support what Mr. Giams have said, and it's already in place. Can we do more? We are doing more. You will notice recently MOH announced that we are now working with GPs and primary care providers. Previously, if you see a primary care provider, a GP, and you say you're sick, he can only prescribe you a PCR test, yeah, which will be go to a lab and reported by the lab. But now he can also prescribe you an ART test. Essentially, he can trigger Protocol 2. Yeah. So we are moving in that direction, and really I must say that to overcome this crisis, it is really not just the government, but requires the cooperation, the civic-mindedness, and the sense of self-responsibility of every individual of our population. Next question is more specific rules on different settings. That is what we have been doing too. If the member has any specific suggestion on specific settings, we'll be happy to hear them. And we are constantly tweaking them. But just one word of caution, sometimes when you tweak more, it becomes more complicated. And people do compare. Why is this setting I'm allowed to do this? Why is that setting I'm not allowed? And you start to have invidious comparison, and people start to get confused. So we are also very mindful to keep rules as simple as possible. So because simplicity is an essential ingredient for people to exercise self-responsibility. What they don't understand, they can't self-enforce. Yeah.
Ms. Fumiha?
Thank you, Speaker. Let me start by wishing Speaker happy birthday.
Thank you.
Speaker, I have two questions for the Minister of Health. One is regarding a question that I raised in my PQ, which is yet to be answered. With Omicron being quite a significant proportion coming from imported cases, I had asked the Minister the breakdown by country of origin of imported COVID-19 Omicron cases. So if the Minister of Health could shed some light on that. My second question relates to his answer being boosters are shown to increase protection against infection and severe illness, including Omicron substantially, whether MOH is now will contemplate imposition of booster jab as a requirement for VTL travelers beyond the current requirement of 2 jabs only, and that will be deemed as a vaccinated. So whether we will bump up the requirement to booster. Thank you.
I must apologize to the members. I don't mean to drop her question, but it will be addressed by Minister Iswaran later in the next set of questions, especially on the specific numbers on breakdown of import cases. As for booster jabs, it is a serious issue that you raise, because we do know that 2 doses doesn't last forever. The EU has already implemented a guideline which is similar to us, 9 months validity or 270 days. So I think the world will converge towards some form of validity, I believe, and naturally this will become a requirement in due course. That is my conjecture.
Mr. Darrow David?
Thank you, Mr. Speaker. Just have one supplementary question for the Minister for Education. Thank you, Minister, for confirming earlier that there will be no vaccination differentiation measures for children in schools who do not get vaccinated. My question, however, is should there be activities beyond school, perhaps, say, if and when the national school games should commence, or if there are national level sporting or athletic activities that would involve children aged from 5 to 11, would there be possibly vaccination differentiation measures implemented then? For example, would there be a position that might say if young children are not vaccinated or not fully vaccinated, they will not be allowed to participate in these events? I ask also primarily because sometimes the results of these events for the children, their timings, their performance and so on, especially for those in primary 6 this year, could be relevant and important in the application for secondary schools under the DSA. Thank you.
Mr. Speaker, sir, if I may, let me explain our thinking at this point in time. Of course, I caveat that by saying that whatever our considerations current at this point in time will subsequently have to take into the prevailing national posture and also the development of the virus and its mutation. At this point in time, we would very much like to have all our children be able to attend school and participate in as many of the core activities as much as possible. Now, having said that, of course, there are also activities beyond the core curriculum that may pose a higher risk to our students. And for those higher risk activities, we will then have to consider if differentiated measures will be required. For example, at this point in time, we have already put in place some additional measures for some of these activities that the students are participating in. And this applies to our secondary school students and our JC students and MI students. So just to give an example, for example, today if they do team sports under the pilot, only the fully vaccinated students who have taken on an on-site ART will be allowed to participate in team sports in groups of up to 10. For some other students who are participating in the band or the choir, they would also have to take some other additional measures to safeguard themselves and their fellow participants. So this is how we will go about considering the participation of our students in this, some of these particularly higher risk activities in the sense that they have a higher risk of transmission. But as far as possible, we'd like to have our students participate in the core curriculum altogether because this adds to their overall social-emotional development beyond their academic development. Thank you.
Mr. Louis Chua.
Thank you, Mr. Speaker. I just have one SQ, which is essentially my PQ that I asked. Given what we know about COVID today over the last 1-2 years worth of experience, may I ask if the government will consider publishing the key quantitative and qualitative matrix and thresholds before decisions are made to actually change the safe management measures. And I do understand the need to be nimble, but basically having that decision-making framework and matrix published would actually help businesses and consumers have greater confidence and clarity, and certainly better than the situation where some people feel a certain sense of nervousness whenever the MMTF has a press conference, especially by the F&B businesses which are most affected by the dine-in rules. Thank you.
Thank you. The member reiterated his question, but I may have to reiterate my answer, which is that, and as alluded in the members' supplementary question as well, we also don't want to be too rigid in setting parameter trigger points. If you cross this, therefore it will shut down from 5 to 2 and so on and so forth. I think there's so many twists and turns in this pandemic. We rather to be a bit more nimble and to be able to adapt. But we take the members' point that, and we have always adopted this position, that we don't go for Freedom Day, neither do we go for zero COVID. We want to strike a balance, preserve the healthcare capacity, at the same time allow people to live life as normally as possible, businesses to be able to operate and able to survive. So and each time we make a decision, we do explain why. We do show all the data, hospitalization, ICU, and so on and so forth, to give the rationale, a full rationale with numbers, why we decide that way. So I hope also over time, people begin to understand what are our key considerations, even though we may not be able to pinpoint trigger points. I should say that ultimately it's not about the numbers that cause all this uncertainty. It's the fact that we're in the middle of a pandemic, and our society for 2 years, we were not entirely ready in the first year as in terms of our resilience. Last year, 2021, we are much better, and I do believe 2022 will be even better. And that is most important. Remember in 2020 when we faced a wave, and it was hardly a wave, it was just clusters. We went into circuit breaker. Last year, 2021, when we faced a wave, we went into what we call phase 2 heightened alert. Group size down to 2. Restaurants didn't close towards the end of the year, but they operate at 2s. Hopefully this year, we can ride through waves with a much more liberal posture. And that's how we keep on improving, and I think that is most important to our businesses.
Cecilia Chen.
Thank you, Mr. Speaker. I have 2 questions for the Minister for Health, and this is with regard to averting a testing crunch that we see around the world amidst a Omicron-driven wave. So my first question is, in the event of such a wave, how do we plan to avoid a run on testing facilities in our healthcare system? For people who are keen to get a test, either PCR or ART. And this includes, of course, primary care providers that the Minister has mentioned in his response or in his answer, but also, importantly, emergency departments. How do you avoid a run on healthcare facilities for people who are keen to get a test ordered? The second question is about self-testing. So how do we plan to ensure an adequate supply of ART kits and to keep prices of these kits steady? Thank you.
Thank you. On the second question first, to keep prices steady and affordable, I think competition helps, choices help. So we are constantly on the lookout for kits that are effective as well as lower price. And that way we bring them in. And recently we have done so, FlowFlex, for example, below $5, and we'll continue to be on the lookout. There have been many kits out there claimed to be cheaper, but not as effective. So HSA doesn't approve all of them, unquestionably. And so we'll continue to do that. As to the member's question, how to prevent a run on testing facilities, number one is to try as much as possible, plan ahead, have supply agreements signed, stock up, and this is what we've been doing, and we continue to monitor the situation, bearing in mind that we've seen in other countries there has been a run. Second, to prevent a run is when people panic. So don't make people panic. Yeah, Omicron can be scary. It can go up a few times. It can be 10,000 cases a day, 15,000 cases a day. That's why we are telling the people now, it can reach that level. That's why we started what we call Protocol 1, 2, 3, specifically Protocol 2, which sensitize people to self-test and self-report and self-discipline. And then we extended this now to GPs to also trigger protocol 2. That way, I think people are sensitized to when I need a test, what do I do after a test? And when people know what they need to do, they don't panic, there's much less chance of a run on any testing facilities.
Mr. Leong Man Wai.
Thank you, Speaker. I would like to ask the Minister for Education to confirm again, although I think he might have said so just now, that the VDS measures will not be applied to the children below 12 years old for as long as it is, and maybe at least until the non-mRNA vaccines are available for the kids, because there's a strong request from the parents that at least there should be more choices for vaccines. And if that is, and if the VDS measures are going to be applied, will not be applied to the children, then all the practices, I also receive feedback from residents that some teachers have already practiced VDS measures in schools. So can the minister confirm that if the teachers are practicing that, or any officers in the schools are practicing that, that is against government policy at the moment? Thank you.
Mr. Speaker, sir, can I seek a clarification from Mr. Leong Man Wai and further information on which schools and what VDS measures have which teachers been practicing, please?
Minister, Speaker, the residents who have feedback to me are on my WhatsApp messages. Can I refer to the messages and then I give a reply later? Thank you.
Mr. Speaker, sir, I would really appreciate if Mr. Leong Man Wai can give me the information of which teacher in which school has practiced what VDS measures so that we can take the feedback seriously and then look into the necessary follow-up if possible. Mr. Speaker, sir, if I may just repeat my answer in case Mr. Leong Man Wai wasn't around just now when I answered this. My specific answer was that at this point in time, we have no plans on applying any VDS in our school. And that's because, for the reasons that I've mentioned, we want, as far as possible, for our students to be able to participate in the core curriculum in the school activities. For certain selected activities that may be deemed of a higher risk, we may consider applying specific measures for them. And I have raised two very specific examples. One, for example, students participating in the playing of wind instruments or the choir, and two, students participating in sports activities that may require physical contact or close physical contact. And I also caveated my explanation by saying that, of course, we will have to look at the overall national posture and how the virus will continue to evolve for us to adjust our policies accordingly. Thank you.
Mr. William.
Thank you, Speaker. I have a clarification for Minister for Health regarding the COVID statistics that he cited earlier, and also in general statistics reported by the government. I've come across cases of individuals who did self-testing by ART and they were positive, but they did not report themselves to the authorities or to any clinics. And with home recovery now as the default response to any positive COVID test, does Minister agree that actually the risk of unreported cases is actually quite high? And to that extent, we need to be quite careful when we look at the official statistics recorded by the ministry. Thank you.
I take the member's point. In every country, they also have a concept of what they call ascertainment rate, which is of the underlying cases, how many are uncovered and reported. And every country know that it cannot be 80, 90, 100%, especially when you have a Delta wave or an Omicron wave that's highly transmissible. You do want people to take self-responsibility, to take care of themselves, isolate themselves, and in these cases, they may not be reported. So they do happen in every country. And to think about it, when we face an endemic disease, whether it's chickenpox, whether it's influenza, we can't report every case. And that's what endemicity means, which is many people get it, many people are able to recover without it officially reported. And that is part and parcel of endemicity. But notwithstanding that, testing remains important for us, first, to exercise self-responsibility, second, to have a sense of what is the prevalence of the virus in the community. And we continue to do quite a fair number of tests, 21,000, over 20,000 PCR tests a day, over 150,000 ART tests a day, some self-monitored, not reported, but many are. And that will always give us a consistent measure of the surveillance, consistent measure of the prevalence of the virus in the community. And we'll continue to do so in a practical way.